Have you ever had a patient turn their head during a brain scan? This creates rotational motion artifacts, which look like circular blur or ghosting lines wrapping around the anatomy. Let's look at how we manage rotational patient movement. Inside the Corsmed MRI simulator, rotational motion models a patient who tilts their head back and forth. We've specified that the patient should rotate their head by 30 degrees. We'll then set the rotation speed to 1 Hz, which means the patient will rotate back and forth exactly 1 time per second. So every 1000 milliseconds, their head will be in the exact same position. The way this movement impacts your scan depends heavily on 2 critical timing settings. Your TR dictates how frequently the scanner checks the anatomy, while TE determines the exact position of the rotation when we read the signal. When every repetition hits a different angle, heavy ghosting will ruin the image. However, if every single repetition catches the patient at the identical spot in their movement, the image looks completely still. Think of it like a playground swing. If a camera captures the swing at the front each time, then every picture looks identical. But if the camera timing is off, you'll sometimes catch the swing at the front, sometimes at the middle, and sometimes at the back. That mismatch is what causes our circular blur. Since our motion cycle lasts 1000 milliseconds, we'll choose a T2 sequence with a TR of exactly 3000 milliseconds. To see the difference, we'll also test 2 other sequences at 3100 and 3020 milliseconds. Let's look at the results. The left image uses a TR of 3100 milliseconds, which falls out of sync by 100 milliseconds, resulting in heavy blur. The middle viewport uses 3020 milliseconds, which is just 20 milliseconds off, so the blur is less severe. Finally, on the right, our 3000 millisecond TR catches the exact same angle every time and delivers a sharp view. Notice that while this image is crisp, the brain is still tilted. That's because we capture the anatomy halfway through the rotation. Instead of a trip to the scanner room to fix their position, we can do our slice planning directly on this tilted axial view. We'll simply follow the anatomical landmarks and align our slice planning to the midline of the brain. This ensures we get high-quality diagnostic images, even when the patient refuses to stay straight.